Hi everyone, this is Kristen Turk here. Today I'm going to be palpating Mark. Mark, is it okay if I palpate some structures on your foot and ankle today?
Yes.
Okay, to start off, what we're going to go ahead and we're going to start with the medial and lateral malleoli. The medial malleolus is the base of the tibia here, and then the lateral malleoli here is the base of the fibula. Coming more medially, we're going to find the dome of the talus. In neutral, it's not as prominent, but if I have him point his toes towards the floor so plantar flex for me, it becomes more prominent and I can feel it between the two malleoli. Okay, coming from the dome of the talus, I'm going to find the calcaneus, so I'm going to turn his foot out here. This bone here is what we consider to be our heel bone, this nice prominent bone here. Going back to the medial malleolus right here, I'm going to come a little bit inferior. Right before I drop off into a soft tissue spot, I'm going to kind of feel like a lead, and that's going to be the sustenaculum tali, this bump right here. Coming a little more anteriorly, I'm going to find the navicular bone right here, the tuberosity of the navicular, very prominent right here. Okay, going from the navicular here, I'm going to go ahead and find the 5 metatarsals, just like what we have in our hands. You can kind of use the lumbrical grip here, and you can kind of separate the different metatarsals. Okay, coming off the 5th metatarsal right here, which is our pinky toe, I'm going to follow it back. Right at the base of the 5th metatarsal is going to be the cuboid. I'm going to run off onto this bony prominence right here, which is going to be the cuboid. And going even more proximally, I'm going to come back to the lateral malleolus, which is right here on the outside, and going inferior to here between the lateral malleolus, I'm going to find the anterior talofibular ligament. It's going to be right in front of the lateral malleolus. It's going to run from the talus to the fibula base, so right here. And then I'm going to find the calcaneal fibular ligament, which is going to be more vertical and deep to the peroneal tendons, which is going to run underneath of the fibular head here. So it's going to run from the calcaneus, our heel bone right here, all the way up to our fibula. And then the last palpation I'm going to go ahead and find is going to be the dorsalis pedis. Coming off in between the 2nd and 3rd metatarsal, I'm going to trace back. And right in here, I'm going to find his dorsalis pedis. And those are my 10 palpation points for this week. Thank you.